So this warm-up slash mobility workout is going to be kind of about helping people who have general low back pain, okay? Now, before we get too far into this, low back pain can be a pretty complicated subject, and there's lots of things that could be causing low back pain. So again, this is just kind of a general catch-all kind of baseline level warm-up that might help a bunch of people who have back pain, okay? Or if your back tends to be a problem area, this could be a warm-up that you do before lower body workout that might help reduce some low back pain that you might experience from a heavy deadlift or heavy squat session after that session, okay? So just like how we normally start out for a bunch of our other problem area, problem area mobility or workouts or warm-ups, is we're going to start with self-myofascial release. So what I'm doing is I'm starting with rolling out my hamstrings on a med ball. Now this spot is actually kind of optional and is not a spot that a lot of people are actually going to need to roll out necessarily. Even when your hamstrings feel tight, a lot of the times your hamstrings feel tight because other spots are causing them to be tight, not necessarily because your hamstrings are the problem, okay? However, rolling out your hamstrings might kind of downregulate that tightness and that pain signal that you might be getting in your hamstrings and allow you to then work into other areas a little bit deeper because your hamstrings aren't necessarily feeling as stiff as they might be. Now, there's some reason why I'm not actually going to start or get into a hamstring stretch, though, because, again, those other problem areas, which tend to be tight hip flexors and tight glutes, tend to pull, or tight hip flexors and then weak glutes and weak abs, tend to pull those, your pelvis forward, and that actually lengthens out the hamstrings, okay? But when that happens, again, your hamstrings get into a lengthened position. Stretching out those hamstrings is just going to further put them into a lengthened position, and that actually might lead to a hamstring injury down the road, okay? If they're too stretched out, it's kind of like stretching a rubber band out too far, okay? So that's why you can kind of use the rolling to kind of down regulate that spot, that tightness that you might have in that spot, but necessarily stretching it out might not be a great idea. Now, the next thing that I'm going to go to is I'm going to roll out my glutes, okay? If we have tight glutes and we don't have a correct amount of mobility in our hips, we're going to get a lot of that kind of dysfunction and that extra mobility, or we're going to kind of get dysfunction up the chain, and that's often going to go into our low back, okay? How that's going to look is we're probably going to steal mobility from our low back that we should be getting from our hips, okay? So a lot of things, or a lot of problems that are caused in the low back is because we have poorly functioning and tight hips from being immobile, sitting in chairs, driving too long. Our hips tend to tighten up, okay? Then we steal that mobility from our lower back, which is called compensatory relative flexibility, okay? So basically, our low back compensates for the flexibility that we should have in other areas, in this case our hips, and we get that mobility from a spot that's supposed to be stable, and which would be our low back. So as you see me starting to roll out my glutes, I'm eventually going to get in to my hips a little bit deeper through stretching, but that's kind of where I'm starting after I get done with my hamstrings. Again, those hamstrings are kind of optional. Then I definitely recommend you start by rolling out your glutes in order to help get rid of some back pain. Okay, another spot that tends to be sore, tight, and locked up are our hip flexors, okay? Again, from being in constant hip flexion from sitting, okay? So hip flexion is when you bring your knee up towards your chest, okay? Now your hip flexors, your psoas muscle and your iliac muscle, okay, attach onto your leg in a spot called the lesser trochanter, okay, in the front of your leg there, okay. Your psoas actually wraps around your lumbar spine or your low back and then crosses through your pelvis area and eventually attaches on that lesser trochanter that is on the front of your leg, okay. So when your psoas muscle very specifically gets very tight, okay, whether it's tight because it's weak or it's just in a shortened position all the time, it can actually pull that back, the lumbar vertebrae, out of alignment, okay? When a muscle gets tight, it pulls the origin and insertion, okay, towards each other, okay? So in the psoas's case, the origin is the transverse processes of the lumbar vertebrae, and then the insertion is the lesser trochanter, okay, of the hip, okay? Or I'm sorry, on the femur. So what I'm doing right now is I'm kind of taking the handle of a kettlebell, okay? I'm jamming the handle kind of right on the inside of my hip bone / kind of the front part of my abdomen, kind of where that those hip flexor muscles come across and cross your pelvis, okay? That pressure of that kettlebell kind of sinks in, okay, kind of through your abdominal wall and kind of gets a little bit into the psoas muscle and starts to release a little bit of pressure that you have there, okay? Again, when you get deeper into this muscle through the hip flexor stretches that we'll be doing later on, but this is, again, kind of our start. Now what you're going to be doing is you're going to be taking big deep breaths in and out, since you actually have fascial connections that go from your hip flexors up through and around your diaphragm and in your ribs. Your breathing mechanics can actually have a really big influence on how short or the position that your hip flexors are actually in, okay? So when you're doing this, you want to make sure that you're taking really big deep breaths in, holding for a second, and then fully exhaling and trying to relax when you're in this position, okay? If you're tense and you're tightened up, that is really bad for a lot of other spots to loosen them up, but it's even exponentially worse for your hip flexors, since your hip flexors do have, again, some fascial connections between themselves and the lungs and the diaphragm, okay? So I'm going to be having the handle of this kettlebell jamming into my hip, and I'm going to be holding this for 2 minutes each side, because this tends to be a really big problem area. And since I'm kind of putting that breathing into the right with my self-myofascial release, I just find that going for a little bit longer kind of increases the effect that I get, okay? So all of the rolling out and stretching that we're going to be doing, you can do between 1 and 2 minutes, depending on each side and each area, depending on the time that you have. But I definitely recommend trying to go for at least 90 seconds to 2 minutes with this kettlebell hip flexor myofascial release, in order for you to kind of get that breathing mechanics down and get the correct breathing patterns associated with this movement. Okay, the last spot that I'm going to be rolling out are my lats, okay? So what I'm going to be doing is I'm going to be rolling out my lats with a med ball there. So I've kind of got that med ball on the outside of my armpit. I'm going to have my hand behind my head. I'm going to be rolling back and forth, and then if I find a spot that's super sore, super tender, I'm going to take my arm, as you just saw me do, have it out straight, and I'm going to move that arm up and back, okay? Your lats are the only muscle that connects your arms, okay? So your humerus, which is your upper arm bone, to your spine, okay? Your lats connect on the spinous processes, or the bone that's sticking out on the end of each vertebrae of your spine, from T6 all the way down to L5, okay? So basically from your mid-back all the way down, okay? Now, because we're constantly grabbing, obviously we're doing things with our arms, we're kind of stuck in internal rotation at our shoulder, okay? Those lats tend to get tight. And because, again, we're doing things that are constantly out in front of us, driving, looking on our phone, writing, doesn't matter, typing on the computer, when our lats get stuck in that internal rotation from our living our life out in front of us, it can also pull on our low back, okay? So this is kind of the last spot that I'm focused on. I think I've helped some people with their low back pain by loosening up their lats. I think the lats are kind of an often forgotten spot when it comes to low back pain and discomfort, and making sure that your lats have enough length in order to actually kind of live through a normal range of motion. You don't want to have short and tight lats, especially for low back pain, especially when you're doing anything with your upper body, because if you're constantly doing things with your upper body, which most of us are doing, and we get stuck in that internal rotation and our lats get tight, it can also pull a lot on our low back. So I'm going to do 1 to 2 minutes each side here. Okay, next thing I'm going to be going to is a banded Bulgarian split squat stretch. So the Bulgarian stretch is a stretch for our hip flexors, okay? So we're trying to basically take the front of our pelvis, okay? If you could imagine kind of where your waistband is on your shorts or on your pants, and you're trying to tuck it into your belly button, okay? You're trying to kind of like you're trying to do a mini crunch. You're trying to take your waistband and tuck it right into your belly button or into your lower ribs to take the front of your pelvis from an anterior pelvic tilt, which is when the front of your pelvis bone is dipping forward and you're trying to posteriorly tilt it when the front of your pelvis is starting to tip back, okay? Now the band, what it's going to be doing is it's going to work on the joint capsule, okay? So basically it's going to intensify this stretch a little bit more, okay? Now you can definitely do a normal Bulgarian split squat stretch here. I just like throwing the band in more, or I like throwing the band in when I'm doing a Bulgarian stretch because, again, I kind of feel it kind of helps me get into a little bit better position by kind of pulling that leg a little bit forward, and allows me to feel that tucking of the hips that we were just talking about a little bit more, okay? So we started by rolling out our hip flexors, or by applying pressure to them. We're trying to relax them with the kettlebell handle. Now we're trying to get a little bit more length into those hip flexors by starting to stretch that area a little bit more and start to open up those hips even a little bit more. So the next spot that we're going to be stretching out is our glutes. We already rolled them out before during our figure 4 rollout, or figure 4 SMR on the med ball. Now we're going to stretch into those with the modified pigeon stretch in order to get into that area and mobilize the hips a little bit deeper. Now we already talked about how properly functioning and mobile hips can have a good effect, or an effect on our low back health and pain level. So we already rolled out our glutes. Again, like I said, we're getting into that a little bit deeper now with this modified pigeon stretch. This is really one of my favorite pigeon stretches, or one of my favorite hip opening stretches. Personally, again, this is one that I just feel a lot. You can really add any type of hip opening stretch that you want here. I prefer the modified pigeon stretch because it really allows me to focus on that external rotation of that front hip. So the external rotation is the motion that you see is kind of happening at my front leg there, okay? When I'm in a normal pigeon pose, really I'm focusing more on is not necessarily that rotation, that kind of flop over that you do with the front leg, but I'm really focusing more on the back leg because I can't necessarily get into that split position because I can't really do the splits currently at this point in my life because of my hip flexor mobility and everything. So that kind of gets in the way of me doing a normal pigeon stretch. However, this modified pigeon stretch where my foot is, or my front leg is up on a bench and my back leg is elevated on pads, again allows me to focus more on that front hip opening, stretching out those glutes on that on the hip that is, or on the side of the hip that is out front, instead of being too focused on getting into the split position. So here I'm going to be holding, again, I'm going to be doing 1 minute in each side. You can do 1 to 2 minutes each side, depending on the amount of time that you have. So the last area that we're actually going to stretch out / decompress is our lats. So again, we rolled out our lats because our lats attach to our low back as well, and when they're tight, they tend to pull and cause a lot of tension in that low back area. The lat hang is a really good way to stretch out those lats and also decompress the low back. We do a lot of things, squatting, deadlifting, any sorts of lunges, heavy carries that compress or basically push our spine together, okay? This is a decompression movement that allows us to kind of pull that spine apart and help it kind of relax and stretch out a little bit and not put as much pressure on those discs, the intervertebral discs that we have in our back. So this decompression is something that you want for a healthy back, because so many of our exercises cause compressive forces, or they push basically the bones in our spine together. So the lat hang is really good to decompress the back and also stretch out the lats. So now we're going to be moving to a more active part of our warm-up. We're going to be performing some low-intensity exercises to start to increase blood flow to some muscles in our back, or muscles that surround our back. And This first exercise is called the reverse hyper. So it's not a common exercise that a lot of people see, or a machine that a lot of people have in their gym. Basically what I'm doing is I'm hanging on to handles. My legs are, as you can see, hanging off that table there. And what I'm gonna kind of do is I'm pulling my legs up and out straight there, okay? What that's doing is that's getting a lot of blood flow into my spinal erectors, which are big, 3 big muscles that run up on either side of my spine and kind of create that like Grand Canyon type effect with your spine. It's going to work the QL, which is your quadratus lumborum, which is a muscle that runs from the top of your pelvis to the bottom of your ribs. It's going to work your glutes and your hamstrings. Your QL, your glutes and your hamstrings very specifically, tend to be very weak, and that weakness tends to cause back pain. So this is a move that we use a lot for people to get a lot of blood into their back and kind of pump it up, and that tends to make it feel really good, okay? Next, we're going to be working on the hip flexors. So we already did lots of stretching of the hip flexors, but to kind of down-regulate that stiffness signal and any pain that we might be having. But one of the reasons we might be having pain, again, we always need to kind of find the reason why we're having pain and stiffness, is that the hip flexors tend to be weak. I mean, again, so this is a kettlebell hip flexion exercise where you can see I have the kettlebell on my foot and then I'm bringing my knee up as high as I can to my chest. Well, unless you're sprinting or performing, movement, unless you're sprinting or jumping, how often have you performed high intensity movements where you're bringing your knee up towards your chest? Not a lot. So that tends to be a very weak muscle. And if our hip flexors are weak, again, we talked about how the hip flexors can kind of encompass the low back and kind of engulf that low back, the lumbar vertebrae. Well, if they're weak and don't have the ability to resist forces to help us create stability in our low back, then that could be one of the reasons why we're getting that pain signal. So we start with the down regulation to kind of like desensitize the area a little bit at the start of the warm-up, and now we're strengthening that area. The last spot that we're going to be strengthening warming up is our glutes. It's been pretty well documented that weak glutes are associated with low back pain. One of the reasons that I think for this specifically is that if you don't have glutes that are strong enough to perform a lot of daily tasks, your low back kind of takes over and it tends to get overworked and tends to do too much of the work. Actually, a lot of people who have painful low backs might have very strong low backs, and again, since the low back can be kind of a sensitive area, that's just kind of where pain happens, but it's not because that's the actual site of the dysfunction. It could be because dysfunction's actually happening above or below the area. So this glute bridge is starting to get some blood flow into our glutes and start to warm those up. Now that we have a lot of blood flow kind of in the area, we're going to perform some mobility drills. I like to do some activation drills, or some, again, quote-unquote activation drills, just to kind of get some blood into specific areas before mobility drills, mostly just because I feel that kind of increases my mobility. Again, getting that blood flow, that general systemic circulation throughout the body or to specific areas that I want to target, and allows me to get a little bit deeper into these mobility movements that you'll see me doing. This one's a hip switch to glute stretch to try to open up my hips. And then this next one is going to be a T-spine rotation, again, to start to mobilize my upper back, since we did a lot of stuff for our glutes already to start to open those up, mobilize them, strengthen them, get some blood flow into that. But we also want to take care of our upper back there too, because dysfunction in our upper back might lead to downstream effects or problems that are happening at our low back because of that. So again, I like to start with some of the activation drills, get some blood flow, get my blood pumping a little bit before I go into mobility exercises, because that just tends to increase the range of motion that I have. I'm not as stiff, I'm not as sore, I got some light movements already, so I can actually get a little bit more out of these mobility exercises. So again, you're going to see me do the hip switch to glute stretch, these T-spine rotations, and then next one you're going to see me do is a cat-cow, okay? So now I'm just kind of generally mobilizing the spine. Now, while we don't want to mobilize our spine under heavy loads, it can be a good mobilization, or really help mobilize some areas that tend to get stiff from not using them or not moving them at all. So again, spinal flexion and rounding like this, and then spinal extension, is not bad or really necessarily harmful unless it's under heavy loads or being performed during movements that they shouldn't be being performed, like a heavy squat or heavy deadlift. So this is actually a really good rehab and prehab tool to start warming up and get some work on your mobility. So the last thing that we're going to be doing for our back and our low back warm-up or workout is we're going to kind of activate, again I say that in air quotes because there's not really anything as activation, but whatever, it doesn't really matter, it's just kind of how you think about it. We're going to activate or kind of get some work for our core, okay? So we're going to be performing 3 different ant-time movements, okay? So our core's main function is to protect our spine by resisting unwanted motion. So this is a dead bug where I'm trying to resist extension, or again kind of that arching of the back. This next one is a side plank where I'm trying to resist lateral flexion or lateral bending side to side of the spine. And then the last one is called a pail-off press, which is an anti-rotation. So that is trying to prevent my spine from twisting, okay? So again, while I just talked about during the cat-cow that unloaded movements, it's kind of okay to flex and extend the spine, and it definitely is. But what I'm going to be using this warm-up or workout for is to kind of prepare myself for a heavy lower body workout where I don't want, if I'm going to be squatting or deadlifting heavy, I don't want any motion to be happening at my spine, okay? And since I don't want any motion to happen at my spine, I'm going to kind of prep that by performing these 3 exercises, okay? These also tend to help a lot of people who are in you know, again, general low back pain, because our core tends to get weak really quick. We don't do a lot of things that, I mean, like, even just, again, from sitting too often or driving too often, that doesn't require a lot of tension and effort from our core to resist motion, because we're kind of using the chair to create stability instead of our actual core and hips and that kind of system there. So these really help general back pain too, because they strengthen those areas and help those areas get better at resisting force.